Boris Johnson, of course, had one job. One job.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
Great. I mean, the one bit of advice that the country has agreed upon, I think, wasn't it? Washing hands and avoiding contact. Yes. But there he is. Absolutely incredible. On a slightly more upbeat note, I suppose, he does appear to have adopted a temporary enthusiasm for people with qualifications and expertise. He's not suggesting that we should try to believe our way out of the coronavirus crisis, or indeed promising that we'll somehow be able to have our vaccines and eat them. Theo Ushwood, you are definitely here. I feel I need to check.
I am here.
And
I've always been here.
We haven't cloned you.
There was a Ben Kentish asked a question.
He did indeed, and it was a very good question. And I just need to ask you, how did you feel sitting in this studio when the Prime Minister of these islands, at a live press conference, announced that you were actually in the room waiting to talk to him?
My name was down to go in, and then we were planning, wargaming how we were going to cover this. Well, it is a significant press conference,
yes.
And it was decided I would be best here listening to the press conference, so I could speak to you immediately afterwards.
But did you have a little wobble, a little panic? I mean, did you think? Do you know what Keith did? You know, Keith put your microphone up because Keith operates like a coiled spring.
Yes.
He's like, so he just heard the name Theo Ushwood. He didn't stop. He didn't stop to wonder whether or not it was plausible that the Prime Minister would be directly addressing LBC's political editor from approximately a mile and a half away.
About 3/4 of a mile.
Keith just thought, he said Theo's name. Theo's got a microphone. My job is to make sure the microphone is live. And there it was.
The Prime Minister saying in this press conference the overwhelming majority of coronavirus cases will those affected will be affected by a mild disease. But he did say that it's highly likely now that we will see a growth in the infection. And from what we understand now from a briefing that we received earlier on today, is that will happen, that growth in the infection will happen in around 2 to 3 months' time. Boris Johnson saying there that at the moment they were at the containment part of the government's response, but that will then move to the delay phase at some point when it becomes impossible to simply prevent the spread of widespread transmission. But as you rightly say, James, the heavy lifting in this press conference was done by Sir Patrick Vallance, the Chief Medical Advisor to the Prime Minister, and of course Professor Chris Whitty, who is the Chief Medical Officer as well. So Patrick Vallance saying that the government is trying to, in effect, flatten the peak of the outbreak so that when it does happen, and we see cases double potentially day by day, that the NHS is able to deal with it because it happens over a 12-week period rather than a sort of surge.
That makes sense, doesn't it? Or not immediately. It's not intuitive, but as he explained, it began to make sense. The areas that the Prime Minister took responsibility for were, I think, less detailed. Asked about the question of people who may not be able to pay their bills if they have to self-isolate.
They're keeping all options on the table.
Under review. He's keeping all options under review.
But they haven't yet decided.
That must be incredibly reassuring to the bus driver we spoke to an hour ago. Don't worry, mate, he's keeping all options under review. And on the question of what the police or the army might do in cases of civil disorder or similar...
Well, they're going to backfill, the army are going to backfill for
long-established plans.
Yes, and the army are
going to backfill. He's got long-established plans, and we're keeping all options under review. And the really interesting question, of course, about whether or not Downing Street is going to reverse its decision to not seek membership of the European pandemic response unit, he just completely ignored.
Yes, we're not going to that. There isn't going to be.
He didn't even go there.
No,
he didn't even mention it. Didn't even acknowledge the question. So the journalist said, "Is it? Are you going to be withdrawing from this euro?" And he started wanging on about Wuhan.
Yes, but you don't. You lose the microphone. James.
No, I'm not having a go at her. I'm having a go at his utter failure to answer a really important question about pandemic response at a governmental level.
Yes. So the other, just a couple of other pieces of important advice. Chris Whitty saying that there's going to be a ramp up potentially in terms of the mortality rate in patients aged over 80, and that to be careful if you're travelling abroad. You can go where you want, but to be careful if you're in that higher risk group, elderly or suffering from other conditions, that you don't go to areas where there isn't a particularly strong health service and there has been an outbreak of coronavirus. That's where the government is advising against travel. Professor Chris Whitty saying that for the even for the higher risk groups, the great majority will survive any outbreak of coronavirus. The figure that's been talked about in terms of the mortality rate and those affected in the worst case scenario is 1%, but that's an absolute worst case scenario. Matt Hancock on the radio when he was on LBC this morning talked about pandemic levels affecting 80% of the population.
Yes. That's where the number came from. I was beginning to wonder whether I'd
So 80% of the population is 52 million,
yes.
53 million, and then in 4/5 of that, 53 million people, so around 42, 43 million, then what you will see is actually only mild symptoms. Those who will be badly affected is around 10 million people, potentially, if we end up at that at that worst case scenario. And there have been implications, of course, of people talking about what it means for the VE Day celebrations, 75th anniversary. There's an extra bank holiday in May, which is going to happen on May the 8th, and whether that's potentially shelved or scaled back significantly.